Hello and a very good afternoon to those who are watching me live on the Facebook page of News 9. Today, in fact, the situation is very, very serious given the fact that a highest spike in COVID-19 cases has been registered in just a single day. I'm talking only about Karnataka. 127 fresh COVID-19 cases have been reported in the state in just a matter of 24 hours. 62, in fact, less than 24 hours, 62 COVID-19 cases have been reported in Mandya. That's where we have our, in fact, the biggest number of cases that's been reported from is Mandya. That's the district. Now here 19 COVID-19 cases have been reported in Davanagere. 11 COVID-19 cases have been reported from Kalaburgi. 6 COVID-19 cases have been reported in Bengaluru. Yes, silver lining is that Bengaluru is not registering a steep increase in the number of COVID-19 cases. But having said that, we are registering cases, let's say, to the numbers of 1, 2 or 3 with each passing day. And today, Bengaluru has registered 6 positive cases. Total number of deaths in Karnataka has also risen to 40 and total number of COVID-19 cases with this in the state rises to 1,373. Just yesterday as well, Karnataka had registered biggest single day spike with 99 cases, but this tally has surpassed yesterday's tally. The numbers are absolutely worrisome given the fact that this is the highest spike in COVID-19 cases. Yes, there have been further relaxations announced by B.S. Yediyurappa just yesterday, and as I also mentioned while interacting with all of you yesterday, that even though there have been relaxations given, that clearly does not mean that COVID-19 threat has subsided. Numbers are speaking for themselves. I already have stated, in fact, the numbers that stand in Karnataka as of now. But if we have to talk about the numbers in India, remember that the COVID-19 tally in India has already crossed 1 lakh mark, and the active cases right now stand at 58,802. Thank you. And 39,173 people have been discharged, while 3,163 people have lost their lives. So this comes at a time when there have been relaxations announced by the central government, by the state government. Of course, Prime Minister Narendra Modi had said that the sort of lockdown that we got to witness in the first phase of course, the lockdown, the restrictions that one got to see during the first phase of lockdown, we won't be getting the same amount of restrictions that one may in fact witness during the fourth phase of the lockdown. Of course, we are in the fourth phase of lockdown, but having said that, the Prime Minister also has said that the only one thing that I would like to stress upon, the Prime Minister had said that the era before COVID-19 was different and the era after COVID-19 is going to be completely different. Prime Minister Narendra Modi, the AIIMS director, doctor, also had said that the numbers in India are expected to increase in the month of June or July. Ladies and gentlemen, yes, there have been relaxations given in the restrictions. The buses will ply, your cabs will ply, taxis will ply, autos will ply. They have been given certain guidelines, but whenever you step out, you might want to think about those who have been risking their lives upfront. We have already entered the 56th day of lockdown. Over 50 days, the entire country has remained in lockdown. The fact is that COVID-19 threat has not subsided. The WHO also has said that we may, in fact, have to learn to live with coronavirus, because right now, vaccine is a distant dream. I have, in fact, a couple of your questions here. Priscilla says, hi Neha. Hi Priscilla, hope you're doing well. Then I have Asif, who says it's become an endemic disease. We have to accept and go through it like HIV. So that's exactly what the WHO also has said, that it may become like an endemic and we may have to live with it for the rest of our lives. So Kumar Prashant says, is all the area assigned in which zones they are? Want to know about Bomanahalli area. Is all the areas, so areas are of course between red zone, orange zone and your green zone. So the relaxations have not been given in the red zone or your containment areas, but relaxations, maximum relaxations have been given in the orange as well as your green zones. So I also have here Arundhati, who says low audio. So if we can just please look into it. The audio, it appears, is low. So Sanjay also says, what are the red zones and quarantine areas in Bengaluru? Please share. I'm going to share all the details with all of you, but I have a lot of questions here that people want me to answer. So of course, Bangalore, as we know that Bengaluru urban largely is in fact under a few areas, of course, fall under the containment zone. Then travel history, cases or contact with the infected people. So I'm going to, in fact, I have with me 127 fresh cases that have been reported in Karnataka, but sharing all of those details, I believe I do not have much time here. But what I can do for you is I can share the contacts of those who have tested positive in Bengaluru. So I have a 54-year-old female who has tested positive in Bengaluru. Then I have a 78-year-old male who also has tested positive in Bengaluru urban. Then I have patient number 1270, a 32-year-old male who has tested positive in Bengaluru urban. Let me just tell you, patient number 1268 contracted the virus from patient number 608. Then again, patient number 1269, a 78-year-old male, also contracted the virus from patient number 608. Patient number 1270 is suffering from influenza-like illness. Then you have patient number 1294, who's a 25-year-old female from Bengaluru urban. She again has contracted the virus from patient number 608. Then I have patient number 1306, a 20-year-old female from Bengaluru urban. She has she's contact of Bengaluru urban containment zone. Then I again have in fact one more case from Bengaluru. Patient number 1364, a 54-year-old male from Bengaluru urban. The authorities still do not know from where exactly did he contract the deadly virus from. Another important point that I would like to stress upon is community transmission. So as per several health experts, as per the Union Home Ministry's briefing, India still has not stepped into phase 3, which is the community transmission. And in order to make sure that India does not step into the phase 3 as well, we all need to do our bit. We need to make sure whenever we are going out, given the fact that there have been relaxations now that have been announced, whenever we are stepping out, we're making sure that we are taking enough preventive measures, we're maintaining social distance, and we're not posing a threat to ourselves as well as to the others. So Asif says now people are risking their lives. How exactly is that? I really don't know what you mean. So Veronica Stevens says we cannot expect anything better with people coming out and disrespecting all the rules. The virus is bound to spread, putting everyone in danger. So this is something that I in fact have been largely asked. So here's a thing. The fact is that coronavirus may never go away. It's a big may. There may be a virus in the future and we may actually be able to deal with COVID-19 pandemic. But till then, the important point is that COVID-19 threat is here to stay. What do we need to do? Yes, relaxations are there. People need to step out. The economy is in shambles. People are losing their job. People are being fired from their, in fact, offices. So what we need to do is, even if we are stepping out, I'm hoping that all of you all are stepping out only to go to your offices and for any other essential work. And none of you is actually roaming out unnecessarily. So whenever we are going out, please make sure you're wearing mask, maintaining social distance and taking all the preventive measures. So another... I have Savio who wants me to answer is domestic airlines start their operations. No, domestic airlines will remain non-functional till the 31st of May. So Norul Asif says, how about inter-district movement? That's allowed with valid passes. Then I have Abdul Ghani who says, why is your channel taken off on Tata Sky? That's the question that almost I have to answer during my every live. So the answer is that we are no longer available on TV. Newsline is going digital. That's the option that we are now going to explore, but we are overwhelmed with the kind of warmth that all of you have shown us. So do we need really pass? Yes, you do need passes, sir. Then I have couple of more questions which on Sundays, what kind of shops will be allowed to open? Any clarification? Ask Selvi. So Selvi, yes, a very important point that I completely forgot to in fact discuss is the fact that COVID-19 threat, as I've said, is not subsided. So the state government, although has decided that they would be giving relaxations, but Sundays are the days when we will be witnessing a complete lockdown. No vehicular movement, nobody stepping out of their houses, what one will get to witness only on Sundays in Karnataka. But answering your question, the essential services will be open, so there's no need to, in fact, indulge in panic purchase. So Satish Hari asked me, why are you off TV? Please come soon. Thank you very much, Satish. We are overwhelmed, but the fact is that News 9 is going digital. As I just answered, we are in fact exploring that option. Will no longer be available on TV. So I guess I've already been with you for a little over 10 minutes. I hope I was more or less able to answer your questions, but thank you so much for joining me and asking me all of these questions. I hope I was able to answer many of them or all your queries. Thank you very, very much for joining me on the Facebook Live of News 9. Do remember to subscribe News 9 YouTube. Follow us on Instagram, Twitter, as well as Facebook. Thank you very much for watching. Stay safe. Stay inside your houses.